Good evening, my dear colleagues. Today we will talk about the role of supplements in protection against COVID-19.
Can you start your video, please?
Dr. Amr?
Yes, Dr. Sahar, you are online.
Okay, okay, I will continue. Is there a rule for nutritional supplement in the COVID-19 pandemic? During COVID-19 pandemic, interest in dietary supplements to support the function of the immune system has been intensified. Although no specific food or supplement can prevent person from contracting COVID-19, certain nutrients may help to support the immune system function. Several agents intended to supplement dietary intake may have theoretical role in preventing or treating COVID-19. Vitamin C, vitamin D, zinc, selenium, omega-3, and N-acetylcysteine have been supposed to be useful for prevention or treatment of COVID-19 due to their potential to influence the immune response and because of their availability as over-the-counter medications. Dietary survey shows that most people are consuming diets that don't meet national guidelines, often because availability or the cost, and such diets don't provide optimal quantities of essential vitamins and minerals. Currently, the ongoing COVID-19 pandemic is likely to put many more individuals at risk of food insecurity and make consuming a healthy diet even more difficult. This becomes increasingly likely if the infection risk mitigation strategies don't include approaches to ensure essential supplies are effectively distributed and accessible, or if the pandemic affects productivity of agricultural sectors. Vitamin D is found. Now we'll talk about vitamin D. Vitamin D is found in foods such as dairy products, cereals, and oily fish. It is converted to its biologically active form, 25-hydroxyvitamin D, in the skin through the effect of ultraviolet beta radiation on 7-dehydrocholesterol. In the late winter, winters and spring, blood levels of vitamin D tend to be low because of reduced sun exposure. Maintaining adequate levels of vitamin D is particularly important for immunity. Vitamin D concentration are lower in people with obesity and those of high blood pressure or diabetes and in smokers. Poor diet in those with heart disease and sedentary lifestyle away from the sunlight contribute to lower blood concentrations of vitamin D, while smoking affects vitamin D and calcium regulation. What about immunomodulatory effect of vitamin D? Vitamin D has immunomodulatory effects, including inhibition of antigen-presenting cells, anti-proliferative effect on T cells, modulating expression and secretion of type 1 interferon, and inhibition of pro-inflammatory cytokines expression, interleukin-6, and tumor necrosis factor alpha. It has been shown that vitamin D is associated with increased anti-inflammatory and decreased pro-inflammatory cytokines in older adults. The positive influence of vitamin D on immune system is helpful during cytokine storm relevant to COVID-19 patients with ARDS. A number of randomized trials have evaluated the effect of vitamin D supplementation for the prevention of acute respiratory infections. A recent study led by Northwestern University researchers found a link between vitamin D levels and cytokine storm, as well as correlation between vitamin D deficiency and mortality. The researchers discovered that patients from countries with high COVID-19 mortality rates had lower levels of vitamin D. However, other research indicates that the link between vitamin D and COVID-19 is likely a correlation rather than a causation. Two recent studies using the data from United Kingdom Biobank, which tracked the health of 500,000 people, they found that when results were adjusted for age, race, obesity, and socioeconomic status, participants who tested positive for the coronavirus were not found to be more likely to have low or deficient levels of vitamin D. The second group found similar results, as after analyzing nearly about 600 participants who tested positive for coronavirus, they found that their vitamin D blood levels were almost identical to those who tested negative for the virus. Observational data consistently associated with low vitamin D levels with acute respiratory tract infections. Patients may also be at risk of ARDS with low vitamin D levels. Trial evidence is less consistent, perhaps because of heterogeneity in the baseline vitamin D levels or the regimens studied. Doses of vitamin D, it is not clear what is the optimal level of vitamin D. The daily recommended dietary allowance from the Institute of Medicine of National Academies is 600 to 800 international units of vitamin D for adults, up to 4,000 international units. Until scientific evidence of emerges, patients should avoid excessive doses of vitamin D in hopes of preventing or treating COVID-19. Long-term consumption of vitamin D in excess of 4,000 international units is considered possibly unsafe and could lead to hypercalcemia. When vitamin D serum levels are lower than 30 nanogram per deciliter, supplementation is encouraged. According to the Endocrine Society Clinical Practice Guideline, a daily dose of 1,000 to 4,000 international unit supplementation of vitamin D is recommended for anyone with chronic disease and a vitamin D concentration level below 30 nanogram per milliliter. Grant et al. Recommended that 10,000 international units per day of vitamin D3 can be given for a few weeks to rapidly raise the level of 25 hydroxy vitamin D levels, followed by 5,000 international units per day to get the concentration of vitamin D higher to up to 40 to 60 nanogram per milliliters in patients with risk of COVID-19 and or influenza. Now we'll talk about vitamin C. Why is vitamin C is important? It is vital for many different processes within our bodies. It is highly efficient antioxidant, which protect important biomolecules in our body, such as carbohydrates, lipids, proteins, and genetic material from being broken down by oxidants. It is a cofactor of many enzymes. Also, it is vital for our immune response. Research has shown certain cells in our immune system, such as phagocytes and T cells, accumulate vitamin C and rely on it to perform their task. It is involved in the production of hormones such as norepinephrine and vasopressin, which have a key role in how our cardiovascular system responds to infection. What evidence is there to support taking vitamin C for COVID-19? There have been hundreds of studies investigating vitamin C, many of which have conflicting results. One of the biggest problems of vitamin C studies is that most don't measure vitamin C concentration before or after supplementation. Supplementation is unlikely to show effect in people whose vitamin C levels already high. Currently, the latest two trials underway, specifically investigating the use of vitamin C to treat severe COVID-19, one in New York and the other in China. As observed in clinical trials, vitamin C shortens the duration, frequency, and severity of the common cold, and also the incidence of pneumonia. Non-COVID-19 related meta-analysis data has demonstrated significant benefits of vitamin C in treatment of sepsis and septic shock. How much vitamin C should be taken? Daily recommended intake have been developed by Food and Nutrition Board. Detected that it depends on the age and sex. The dose for adults is 90 milligram per men and 75 milligram for women. A systematic review and meta-analysis on the role of vitamin C for preventing and treating the common cold didn't find any conclusive evidence to indicate that there is a benefit of vitamin C mega doses for prophylaxis in the community to reduce the incidence of common cold. Can taking too much vitamin C cause side effects? Yes. Taking more than 2,000 milligrams of vitamin C per day may cause stomach upsets, including abdominal pain, diarrhea, or nausea. What foods contain vitamin C? In general, fruits contain more vitamin C than vegetables. Some examples of foods that contain high level of vitamin C: grapefruit, orange juice, kiwi fruit, broccoli, strawberries, orange, sweet potatoes, and tomatoes. Experts consider diet that supplies 100 to 200 milligrams per day of vitamin C provides enough vitamin C to cover a healthy individual general requirements. People with medical conditions such as cancer, diabetes, lung disease, or who smoke or exercise a lot should consider increasing their dietary intake of vitamin C. When should people consider vitamin C supplements? Vitamin C supplements are relatively cheap and should be considered in the following people whose diets may be deficient in vitamin C or their absorption of vitamin C may be impaired. For example, anybody who doesn't eat fruits or vegetables on most of days of the week, babies fed on cow's milk, individuals with eating disorders, older people with poor diet, people undertaking hemodialysis, people with food allergies with restricted intake, people who cannot afford buy fruits or vegetables, people who have too much iron in their blood as iron overload or hemochromatosis, people with disorders of GI tract like Crohn's disease and ulcerative colitis. What about zinc for COVID-19 intervention? Trace elements such as copper, manganese, and zinc have immunomodulatory properties. Zinc is an essential mineral with a wide range of roles in the human body, including supporting the function over 300 enzymes. The body needs zinc to carry out normal metabolism and ensure proper function of the reproductive, cardiovascular, nervous system, and our sense organs, taste, and smell. Zinc supports the production and maturation of white blood cells, which are the major players in the immune system. It is vital for our immune system function, including maintaining integrity of our skin and for cells mediating immunity, such as neutrophils and killer cells. Zinc also helps to regulate inflammation. Inadequate zinc levels limit the individual's ability to mount an adequate immune response to infection. COVID-19 is a new disease and we are still learning about it. So up to date, there hasn't been any specific studies of zinc for COVID-19 and we can only look at its effect in other conditions. Zinc gluconate at a dose of 13 milligrams reduced the symptoms of common cold by more than 3 days in 100 patients study. Zinc was shown to inhibit the activity and replication of another coronavirus, SARS-CoV, which caused an outbreak in 2002 in the laboratory. In vitro studies have demonstrated that zinc can inhibit the enzymatic activity and replication of SARS-CoV RNA polymerase and may inhibit angiotensin converting enzyme to activity. Oral zinc supplementation reduces the incidence rate of acute respiratory infection by 30% 35%, shortens the duration of flu-like symptoms by approximately 2 days, and improves the rate of recovery. One study reported that zinc may possess protective effect as adjuvant therapy of COVID-19 through reducing inflammation, improvement of mucociliary clearance, prevention of ventilator-induced lung injury, modulation of antiviral and antibacterial immunity. How much zinc we need? The recommended daily allowance for elemental zinc differ according to age and sex, but for adults, for women, 8 milligram and maximum 40 milligram per day. Adult men, 11 milligram, maximum 40 milligram per day. Oysters contain the most zinc with 74 milligram per one serving, but there are also a variety of everyday food can be incorporated in diet, including beans, nuts, whole grains, dairy products, chicken, meat, and fortified cereals. Phytate in vegetables and grains can reduce the absorption of zinc, and therefore vegetarians and vegans need 50% more zinc in their diet. Vegetarians should note that foods such as garlic and onions may increase the absorption of zinc from plant foods. According to the World Health Organization, there are no approved guidelines to use zinc for COVID-19. Doses over the maximum daily allowance of 40 milligram per day may give metallic taste in the mouth and nausea and vomiting with loss of appetite and loss of smell. High doses may lead to copper deficiency, anemia. Only short courses of therapy are recommended. Zinc supplements also interact with medicine such as antibiotics, diuretics, and penicillamine. Now we'll talk about immunomodulatory role of omega-3 fatty acids. Omega-3 fatty acids exert antiviral effect by inhibiting influenza virus replication. According to the ESPEN expert statement, the use of omega-3 fatty acids may improve oxygenation in COVID-19 patients, although firm evidence is still missing. Others, however, have suggested caution in the use of omega-3 in COVID-19 patients. Selenium. Selenium is another trace element that has a wide range of pleiotropic effect, ranging from antioxidant effect and anti-inflammatory properties. In addition, selenium reduces the formation of thrombosis in the blood vessels and the formation of microclots, which is a significant cause of death in patients with COVID-19. Low selenium status has been associated with an increased risk of mortality, poor immune function, and cognitive decline. It is claimed that to slow down viral replication, and mutations. In addition to helping the immune system work properly, selenium helps to prevent damage to cells and tissues. It also plays a role in reproduction. Good sources of the selenium include Brazil nuts, fish, meat, and eggs. The recommended dietary allowance for adults is 55 microgram per day, with 400 microgram per day being set as the safe upper limits. Selenium is possibly unsafe when taken in high doses for a long time. Taking doses above 400 microgram can increase the risk of developing selenium toxicity and side effects as nausea, vomiting, nail changes, loss of energy, and irritability. Taken for a long time, doses higher than recommended dietary allowance can also increase the risk of developing diabetes. Selenium might slow blood clotting. Taking selenium along with medication that slow clotting may increase the chances for bruising and bleeding. N-acetylcysteine. Glutathione is an endogenous antioxidant that's frequently developed in patients with oxidative stress on systemic inflammation, including those with chronic obstructive pulmonary disease and acute respiratory distress syndrome. After systemic administration of N-acetylcysteine, it is rapidly converted to cysteine, which is the precursor of glutathione, leading to significant increase in plasma and alveolar glutathione concentration. Administration in vitro and in vivo lead to anti-inflammatory effect, and antioxidant effect in a number of pulmonary diseases, including viral pneumonia and acute respiratory distress syndrome.
Sahar, we are
However,
time. We should not more than 1 minute to finish the test.
um,
You have 1 minute to finish the test.
can I continue?
Yes.
Yes, okay. However, these effects have not consistently translated into clinical outcome benefits in patients with hyperinflammatory disease, and N-acetylcysteine is not routinely used as an anti-inflammatory or antioxidant in clinical practice. Conclusion: strengthening the immune system and searching for effective antiviral treatments will continue to be the most important, but these approaches must be used in combination with masks, social distance, and adherence to other public health recommendations. First and foremost, supplements should not replace medications, healthy diet, hydration, hand washing, and social distance. There is currently no evidence supporting use of supplements, including vitamins and minerals, to prevent or treat infection with COVID-19. Thank you.
Thanks a lot, Dr. Sahar, for your very informative presentation. And now we have finished the how to